We have got a pretty tight agenda today with lots of information to share with you all, so we're gonna get right on ahead and get started. Next slide, please. Like I said earlier, this is another edition of the Wednesday briefing TJC has been hosting to keep all of our Tennessee community partners up to date on the federal budget cuts that are currently proposed. So just a little bit of housekeeping. This will be recorded. We record every single one of our calls, and they will be the recording and the slides will be sent out to all registered participants. So if you miss something or want to get more in depth on some information that we share, you will have a chance to do that. Half of today will be reserved for Q&A. So if you see something that you want to learn more about, please use the Q&A feature to submit your question, and we will get to it through our panelists later on. Finally, like we said, please introduce yourself and please use the chat to react to the information that we share and let us know what you think of these very timely updates that we present today. So we want this to be interactive. We want this to be interesting to you all. So please share your thoughts and keep this as an engaging and lively discussion. We also have a react feature, which we we like to use to see what information is compelling to you all. So don't hesitate to use that as well. Thank you to everyone who's already jumping in and introducing themselves. We're so glad to have you all here today. Next slide, please. So the way this goes is we have a bit of a welcome from me. I'm your moderator today. My name is Jane Demobi. I'm an Equal Justice Works Fellow. I'm an attorney here at TJC, and I work across Medicaid and SNAP. So I'll be walking us through all of the topics today, the many topics we'll cover. We'll hear from Gordon Bonnyman, who's a staff attorney at TJC, as well as a co-founder of the organization. He'll provide some expert analysis of the Medicaid landscape, letting us know what has been proposed, how that'll affect Tennessee, and what you can do about it. After the Medicaid presentation, we will hear from Signe Anderson, who is TJC's Senior Director of Nutrition Advocacy. Signe will walk us through the proposed cuts to SNAP, and once again, the ins and outs of the policy discussion and what you can do about it. After we hear from Gordon and Signe, we'll have a Q&A portion and then inform you all of, like I said earlier, the call to action and how you can take action to stop the proposed cuts. So that's our agenda for today. And if you can go to the next slide, I'll hand it over to Gordon. Okay, Gordon, take it away.
Thank you. Thank you, Jane. Next slide, please. So just a quick refresher and sort of level setting about where we are. We've been in the budget reconciliation process, which is a special procedural mechanism that Congress can use to avoid filibuster in the Senate and fast track budget related legislation. It's being used as a vehicle for pushing through renewal of President Trump's 2017 tax cuts and the expansion of those tax cuts. It's also being used as a vehicle for cutting the social safety net and monkeying with tax exempt status for various organizations and doing a number of other things to the tax code, including child tax credits. So there's a lot in it, and unfortunately, a lot of it is very destructive. We're going to talk about the cuts to the safety net today. As we've been discussing in recent weeks, the House committee proposal, House committee instructions to the committees were to draft over $1 trillion worth of cuts to safety net, and $880 billion from Medicaid, $230 billion from SNAP. Those were sent to the respective committees in the House to craft the legislation that would achieve that level of cuts. And the mechanics are the House passes budget bills first, and those then go to the Senate. This week, the House committees released the proposed amendments to make those cuts. And up until now, we've been having to say, we don't know what they look like. We only know that at that level of cut, it's going to be quite destructive. Next slide, please. But now we know. The timetable is markup is ended probably within the past hour. If it hasn't, it'll end within the next hour or two. Markup of the health amendments, the Medicaid and ACA Affordable Care Act amendments, started yesterday at 1 o'clock Central. It was limited to 24 hours. Basically, it was an effort by Democrats to amend the bill. It was foregone conclusion that those would all be voted down by the majority, GOP majority in the Energy and Commerce Committee. But there were demonstrations in the committee hearing against the cuts, and the Democrats continued to offer amendments as a way of messaging about the destructive nature of the cuts. Those will, if they haven't already been voted out of committee, will soon be voted out of committee. They will go to the Rules Committee in the House by Monday, and then probably be on the floor by Wednesday, a week from today. So that's really crucial. Once they pass the House, as I said, it goes to the Senate. Senate committees are already working on their proposals. They may well accept the House version because, of course, there have been negotiations between the House and Senate staffs as that process has gone along in parallel. They're all operating under the compulsion of President Trump's mandate to return to him the bill by the 4th of July. It's expected the Senate will probably vote in early to mid-June. So we've been saying for some time that this is an existential threat to the safety net, and that we have only a short period of time to respond. And indeed, we are now at crunch time. Next slide, please. So I'm just going to talk for a second about the big picture as it affects Medicaid and the ACA. President Trump, you will recall, has repeatedly pledged that Congress, quote, won't touch Medicaid. And he has said that he loves and cherishes Medicaid. Unfortunately, Congress has not heard that, and it will cut over $700 billion for Medicaid and ACA coverage. The remainder of the $880 billion mandate that was given to the Energy and Commerce Committee is coming from other sectors of the budget, but $700 billion from Medicaid and ACA coverage. The Nonpartisan Congressional Budget Office, or CBO, says that over 13 million will lose health coverage, 7.6 million will lose Medicaid or ACA coverage, and another 6 million will become uninsured as a result of the refusal of Congress to extend enhanced premium tax credits that are expiring, and from restrictions on the ACA marketplace. So if you see the rhetoric that there's no cuts to Medicaid beneficiaries, that's simply not what is being voted on right now. Next slide, please. But it isn't just the impact on the program's beneficiaries. For example, as we see in all big, going back 200 years, anytime there's a big congressional must-pass piece of legislation, it gets larded up with a lot of other things that special interests manage to get in there. The nursing homes and the hedge funds that increasingly manage the nursing home, own the nursing home industry, got a big gift from Congress in the elimination of new nursing home standards that families and advocates have fought for several decades, to try to set minimum staffing requirements for nursing homes, and those are being done away with. This also, apart from the impact on healthcare, exposes millions of families to medical bankruptcy by eliminating Medicaid coverage of bills incurred before application. So as it is now in Tennessee, pregnant women and children, if they incur bills up to 3 months before they finally apply for Medicaid, those can be covered, and that will be limited to 1 month. So all that's doing is increasing medical debt on households. Next slide, please. By cutting the revenues, the bill undermines struggling rural hospitals, nursing homes, emergency medical services in rural counties. Those are all very dependent upon TennCare funding, and it reduces access to care for the entire community. If you close a rural hospital, it's not only the Medicaid beneficiaries that lose access to local hospital services, it's everyone in the community. And it also has a devastating economic impact because healthcare is either the first or second behind public schools employer in small counties. And so if you erode the safety net infrastructure, that translates into jobs, and it has a ripple effect across the local economy. The bill also has a provision that does away with incentives for the development of prescription drugs to treat so-called orphan illnesses that can be quite devastating, but the number of people who suffer from those illnesses or conditions is not large enough to be an attractive market for pharmaceutical companies to go and invest in developing a drug. And there are provisions right now in the law that give incentives for drug companies to do that research and develop those therapeutics, and that's being eliminated. And the bill spurns President Trump's bid to achieve savings by reducing Medicaid drug prices. He had behind the scenes apparently been urging Congress not to cut the program because he's well aware of polling that shows that 76% of Americans, including a majority of his own followers, support protection and even expansion of Medicaid. Next slide, please. So let's talk about the major items that affect Tennessee, because the policies that they've settled on in this bill have different effects in different states. As you probably know, Tennessee is one of only 10 states that have denied its residents access to expanded Medicaid coverage under the Affordable Care Act. And probably everybody on this webinar has been supportive of Medicaid expansion for the past 10 years, and sorry to see what the economic impact is on our state of foregoing the billions of dollars that would have produced, and more importantly, what that means in terms of needless human suffering and loss of life for the 300,000 people that go without coverage, and with all the increased morbidity and mortality that that entails. So we have been working on that, hoping for that, and during the Biden administration, Congress created some significant incentive payments for Medicaid expansion. Our state hadn't taken up on those, but we have expected that when the economy softens and the state is looking for revenues, that would be a big incentive to expand Medicaid. Well, this legislation would eliminate those incentive payments. There would still be matching payments, but the big inducement to sign up is not there. It has also restricted our ability to use some financing options to cover the state share. As you probably know, the state has to pay 10% of the cost of the Medicaid expansion, and our ability to do that will now be restricted. So bad news for the 300,000 uninsured adults with disabilities or in low-wage jobs who are not eligible for Medicaid now, but would be, but for this legislation in the future. Next slide, please. Big ticket item that you probably heard about is work requirements. And I'm going to talk about two pieces of the work requirements. One is what's in this bill, and the other is what's pending right now that affects Tennessee directly. The work reporting requirements that you'll be reading about and hearing about that are in this bill would apply to everyone 1964 unless parent or caregiver or having someone with a disability. They must have already been working during the month before applying. And to meet the requirement, they have to be working or involved in, quote, community engagement, volunteer activities, or school for 80 hours a month. The Arkansas experience, which tried work requirements, shows that red tape rather than the work requirement itself is what costs people coverage. It's not that people are not working and therefore lose it. It's that they are working or they are exempt for good reason, but the bureaucracy can't process all that accurately and they get cut off anyway. If you want to know whether this is really about putting people to work or about reducing federal expenditures for medical care, the evidence of what it's really about is that CBO, the Congressional Budget Office, says it will reduce federal expenditures for medical care by $300 billion. That's what this whole process is about. It's about taking away health care from Americans. It does not take effect until after the next presidential election in January 2029. So that's the good news, and it has, unless and until we expand Medicaid to cover childless adults, it will have little direct effect in Tennessee because it applies to working age adults unless they're a parent or a caregiver. And the only adults that are eligible in our state by and large are those who either have a disability or are parental or family caregivers of minor children or have breast and cervical cancer. So it's basically does not affect us directly. Next slide. However, it has a really significant potential effect, which is that it could open the door to approval of a 2018 Tennessee waiver request. The states that administer Medicaid programs can submit a so-called waiver request to the Federal Centers for Medicare Medicaid Services, or CMS, saying, would you please waive or exempt us from complying with certain federal limitations. And it has been illegal until now, courts have ruled, to impose work requirements as a condition of eligibility. And in 2018, Tennessee submitted a request for a work requirement waiver. And thanks to the advocacy of a lot of people in this webinar and elsewhere, it never got acted on, but it has been sitting there and it is pending right now. And tomorrow afternoon, if they wanted to, CMS could grant it. And the reason why it hasn't been acted on is that federal courts in the District of Columbia had ruled that it was illegal. So the Arkansas experiment that has given us a lot of evidence about how these things actually work, that was stricken, along with proposals to implement work requirements in several other states. Those were all on hold. If Congress legislates that it's okay to have work requirements, even though ours is more stringent, that could encourage the Trump administration to give it a go and say, let's grant the Tennessee waiver. And the Tennessee waiver defines work requirements much more harshly than even the pending bill in Congress, because it applies to all able-bodied working age adult enrollees without dependent children under the age of 6. That's a quotation from the state law that mandated the submission of the waiver. Gives no consideration to whether a person who's expected to work is a caregiver for children or adults with special needs. It does not take into account at all what wages or jobs may be available, or whether it would cost more for transportation and childcare than the person would make in wages. It's particularly impactful in rural areas. Georgetown University Center for Children and Families projected back when the waiver was submitted that 68,000 parents would lose their coverage. So that's a really big worry, even though you won't read about it in the national press. That's our own kind of special Tennessee threat from this legislation. And I'm going to turn it back to Jane at this point.
Thank you for that, Gordon. And just to put a face behind the fear and the concern around work requirements that Gordon just clearly explained, I'm going to share a story from a former TJC client back in 2018, when these threats were very, very real here in our state. Let you know what they experienced and just in their words. Malcolm Alemo celebrated his 4th birthday on March 14th. Throughout the day, which began with Mickey Mouse pancakes and ended with a Curious George cake, he played outside with his family and opened presents. But unlike other 4-year-olds, every birthday he celebrates is a minor miracle. That's because Malcolm was born with congenital cytomegalovirus, an infection that has resulted in a host of neurological deficits and organ functioning issues. He is bilaterally deaf, has issues with his heart and kidneys, suffers seizures, and has cerebral palsy. Despite such obstacles, he's able to articulate sounds, listen to music, walk, and run. He's lovingly called the Usain Bolt of toddlers, all thanks to medical care, therapy, and the omnipresence of his mother, Danielle Alemo. Malcolm would not be alive if he didn't have a constant continuity of care monitoring everything. Danielle and Malcolm were 10 care recipients, and that allowed Danielle to be her son's full-time caretaker. Next slide, please. In 2018, when there were threats of Tennessee imposing work requirements on TennCare recipients like Danielle and Malcolm, the state pushed to submit a waiver that would impose them on able-bodied working age TennCare recipients. Those affected by the legislation would be parents or caretakers with children from 6 to 20 years old. There were no clear exemptions in the bill that was put forward. Alamo feared the legislation would give her few choices: get a job, seek disability with the state, or move her family once again. With 2 children, she was frank in her assessment of her prospect of getting a job, given Malcolm's needs. She said she's only qualified for a low-paying job, and if she worked, she'd then have to pay for a babysitter and a nurse to care for her son. If we're all working the same amount of hours and I'm making the least amount, I can't pay these guys, Alamo said in an interview. Despite having traumatic brain surgery, she did not want to get on disability, and the prospect of leaving the state was very daunting. The Alamos had moved here to Tennessee after Hurricane Irma forced them out of South Carolina. She said, "The idea that I have to pick and choose between getting a job and continuing to fight for him makes me feel like Tennessee does not want me here, and perhaps I should leave. Though the community loves me, the politicians don't care." This is just one of many stories of the work requirements and what they would do to families, real families here in Tennessee. And once again, just thank you to Danielle Alamo. The Alamos are clients who are so willing to share their story and allow us to present them to you all today. And now I'm going to turn it back to Gord to briefly conclude the Medicaid portion.
Thank you, Jane. And the sequel to that is that sadly, Danielle did feel that she needed to move, and did. So let's talk about the other items in the bill that affect Medicaid, the big ticket items. And there's a lot in there, but I'm just talking about the large items. The main thrust of this is to bog people down with red tape. And thanks to the efforts of people in this webinar and millions of others across the country that have raised their voices in protection of Medicaid, the Republican leadership has wanted to avoid conspicuous elimination of eligibility that would open them to the criticisms of cutting Medicaid. They want to be able to say, we're only tightening the restrictions on fraud, abuse, and waste. But in fact, as the Congressional Budget Office has made clear, they're going to be taking coverage away from millions of people. And the main way they do that, which makes it a little bit less obvious, is by just increasing the paperwork. One of the things they do is, the bill would do, is reinstate barriers to enrollment in Medicare savings programs that cover 250,000 Tennesseans who are on Medicare as well as on Medicaid, and they have low incomes, fixed incomes on Social Security, and it makes it difficult for them to pay the Medicare premiums and cost sharing. And the Medicare savings program is a vital safety net that picks up those costs for 250,000 older and Tennesseans and disabled workers. And enrollment for them has been a nightmare. Tens of thousands lost their coverage over the past 2 years in Tennessee for paperwork barriers. The Biden administration had, after a long comment period, had developed a whole set of efforts to streamline their enrollment so that the government already has information that shows that they're eligible. They would just be automatically enrolled, and those are being wound back and undone. It makes it harder to keep young children enrolled. Again, there were provisions that would make it easier for children to get on and stay on the program. Those are undone. And then it creates harsh financial penalties for states that enroll people who are ineligible, that make errors. And so, but there's no penalties if they deny coverage to people who are eligible. So it's a one-way bias that says, watch out, states, you could lose money if you enroll people, but you don't stand to face penalties if you improperly deny someone who's eligible. So those are the kinds of subtle but very real and very effective ways of denying coverage, of cutting access to healthcare. CBO projects these changes will eliminate $162.7 billion in spending for healthcare. Next slide, please. And we know a lot about that in Tennessee because we have a lot of experience with it. CBO projects, as I said, that it will save $162.7 billion. In 2023, 2024, TennCare terminated 400,000 children and adults during a mass redetermination of eligibility at the end of the COVID pandemic. And 75% of those who were terminated not because they were found ineligible, but because of their failure or inability to complete the burdensome, flawed process. People would submit proof of their income or other eligibility documents only to have that lost or assigned to the wrong household. They would have to wait for a long time on hold to try to get through to the TennCare call center, only to have that dropped. I mean, it was just a bureaucratic nightmare, and there were whole categories of eligibility the federal court found that were improperly denied because the computer failed to consider them properly. So you don't have to explicitly change the rules. You can just make the paperwork barriers higher in order to keep people off. So I'm going to turn it back to Jane at this point.
Thanks, Gordon. So we heard all about Medicaid, and now we have Signe on the line to talk us through what the potential cuts would look like for SNAP. Signe, take it away.
Hi, everyone. Thanks for the introductions, Jane. We have a few more details since last week, and you can go to the next slide. Just like Gordon mentioned for Medicaid, we have some more of the big picture for SNAP. Gordon lifted up that the House amendment has up until now proposed about $230 billion in cuts from SNAP. But now it's looking like it's going to be closer to 300, if not more than that. The official CBO is not out yet, but we will keep you posted. On the next slide, I'll just give you an overview. So yesterday, the House Committee on Agriculture started their SNAP markups last night around 7 p.m. and adjourned just before midnight. They're back at it now. So as we speak, they're going through many amendments proposed mostly by Democrats, kind of like Gordon mentioned for Medicaid. And this gives you a sense of what we found out late Monday night and what's been discussed as of yesterday evening and into today. Just to give you a breakdown of some of what's on the reconciliation bill, major cuts to SNAP, worse than we anticipated it would be bad, but it's even worse. An estimated 3 million people could potentially be cut. State cost share is one of the big pieces that are coming forward. In the last few weeks, there's been talk about states putting forth more money to front the cost of the SNAP program. In addition to that, some of the other things that we've talked about in past weeks, cuts to the actual benefit amount, or at least keeping it stagnant so that there are no increases for families. There are even more expanded work requirement details out. There's also more information that has come out as of Monday night about limiting shelter costs and ending internet support that Congress had originally agreed upon. Also delayed benefits for people moving to new states. And then the other fairly new piece of information we got is just complete elimination of SNAP education. And I'll go into more details in the next slide. You can go to the next slide. So with each of these, I'm going to go into the detail of it, talk about what it is, and talk about how it impacts the state, and also share what's currently happening wherever I can. So on the state cost requirement, they are looking to make states responsible for 75% of administrative costs. Right now in Tennessee, the current state cost is at 50%. So for Tennessee in 2023, that was about $256 million that Tennessee had to front for for managing the administrative side of it. They are planning to lift that up to 75%, which would increase, if you're looking at 2023 numbers, it would increase the cost for Tennessee up to $385 million. So a much larger cost to administer the program. The state responsibility for benefits, that's never been a thing before. That is a major change. The actual SNAP dollar amount, the federal government pays for SNAP benefits, and so now they're proposing that states come up with potentially 25% of the benefit amount to help pay for benefits. And so this would no longer be a strictly federal cost. So just to give you a sense of what that means, Tennessee received $1.26 billion in SNAP benefits for families in 2024. If Tennessee were to front 25% of that, that would be $15 million that Tennessee would have to fund of that cost. And just to give some folks I know who have been on the line, have been advocating with us for the summer EBT program. Tennessee would not do the summer EBT program, which costs $3 million. So just take that into account, $3 million versus $315 million. So this is kind of a major, piece of the legislation that will be problematic. The next slide, if we can go to the next slide and talk about some of the other things. The other piece that we've been talking about as well is cuts to SNAP benefit amounts. For folks who really want to dig into this, I've also included the section where it is in the proposal. So for the SNAP benefit amount, just to give you a little bit of background on that, in 2018, during the 2018 Farm Bill, under the first Trump administration, Congress directed USDA to reevaluate the underlying food costs used for SNAP benefit amounts through the Thrifty Food Plan. And as a result, in 2021, USDA decided to increase the benefit amount. It had been 50 years since the SNAP benefit amount had been reevaluated, and it was determined that the benefit should increase. And so now on average, families receive about $6 a day in order to feed themselves. And that's not a lot of money. Before that, it was $4 a day. So Congress is looking to either cut those benefits, and that would impact every single Tennessean, or it would remain stagnant, so that moving forward, they wouldn't take into account other factors that are really important to look at when thinking about, is the benefit amount enough? So that's another major cut to potential cut to the program nationwide and to Tennessee families. We can go to the next slide. The other major change is expanding work requirements. Work requirements already exist. They're very administratively burdensome to the state. To increase it would increase the burden on the state. It is also extremely burdensome to families. And we see a lot of families who fall through the cracks when they shouldn't, and they should be able to receive SNAP benefits. And I think the most important point here is work requirements just don't work the way that this legislation and proposal is meant to. The idea behind this is taking food away from people will incentivize them to work, when in reality, taking food away from individuals makes it much harder to find work. And the other point that I want to lift up is most Tennesseans who are working do work, and if they aren't, there are usually some reasons for why they're struggling to find unemployment, or why they're struggling to find employment. So this will expand work requirements in a few different ways. It will now require families with children to meet work requirements. So that means grandparents and parents of children ages 7 and older will be required to meet a work requirement. This is also extremely problematic for single parents. It will also severely restrict the state from waiving time limits in areas with high unemployment. Right before the pandemic, Tennessee kind of walked away from applying for these time limit waivers in counties with high unemployment, but following the Great Recession, 86 counties in Tennessee had lifted the work requirement because they realized that there was not employment to be found. And so requiring people to find work when there isn't work is really problematic. And so Congress is proposing to take away these waivers and overlook the economic impact that might exist during economic downturns, and really restricting states from being able to address unemployment and being able to keep people fed during these times. And then the other piece that I would lift up is there are discretionary waivers that Tennessee can use for individuals in certain cases. In the past, Tennessee has historically used some of these waivers for individuals who are for survivors of domestic violence, for veterans who sometimes face discrimination when trying to find employment, even for individuals exiting prison who sometimes have trouble finding work. And so they're trying to take away those individual waivers almost completely as well. So that's the work requirement piece. We'll go into the next slide. And this is looking at limiting the state option to calculate utilities and end funding for internet. This will reduce a state's option to calculate shelter costs based on household eligibility for fuel assistance. The utility costs, known as the standard utility allowance, are part of costs of living that impact the SNAP benefit amount. So the proposal would limit the use of this option for fuel assistance recipients to only SNAP households with at least one member who is 60 or older or receiving disability benefits. And then the other piece is there was some legislation and some work to allow states to count internet costs as a part of the SUA, understanding that having access to internet is really important for low-income families, especially when just thinking about Tennessee, our state that is moving most of their systems to an online system. It requires that families have access to internet. And so there were some provisions in place to help fund those internet costs for low-income families, and they're peeling that back as well. But we can go to the next slide. All right, more devil in the detail slides. The other piece is delaying benefits for individuals moving to new states. We did not have these details before, but they're looking at delaying applicants who were getting SNAP in another state and have moved from accessing benefits in a previous state. So the proposal does not address the bureaucracy to ensure that people who move can readily close their cases in the state that they left, so that they can transition that to the new state immediately. So there's some problems with that as well. Just given the state that we live in, that is bordered by so many different states, it's something that I think we should care about. The next slide, I think, is the last one that we're lifting up. So the other piece that's relatively new is that they plan to eliminate SNAP nutrition education. And the proposal does not, the proposal doesn't address how to improve, the proposal is really meant to knock these out completely. And in the past, Tennessee we've received $5.2 million in funding, and There's a lot of jobs that are created through the SNAP Ed programs. A lot of people that are given education and information is really focused at addressing obesity and providing information about eating healthy and moving folks to use their benefits in ways that are really healthy, forward thinking. And I think we're running up on time, so I'm going to turn it over to Jane. I know she has some stories of some of the families that we've been working with, and that would really be impacted by some of these changes.
Yeah, these are some snippets of some stories that clients have sent to us, or folks who are using SNAP have sent to us. So this is in their own words, to give, again, a context, a real face to all the changes that Signe just expertly went through. So we have one parent from Murfreesboro, Tennessee, who said, "Me and my children would starve without SNAP. I'm a single parent without an income. She's a mom from Murfreesboro and she does not have transportation, nor can she afford childcare." Another mother from Smyrna says she receives SNAPs for her and her 2 kids. She works part-time for Instacart. With SNAP, her family doesn't go to bed hungry. In her words, SNAP has saved us. Another mother from Springfield, Tennessee. She says, "I have 3 children. I only get paid $13.90 an hour. I don't get many hours at work and I have to pay for daycare for my daughter out of pocket. After pay for daycare, I hardly have enough money to put gas in my car and buy necessities for me and my children." So like Signe said, these are disastrous cuts for Tennessee. We live in a state that hasn't necessarily always ponied up the dollars to improve our SNAP program. So we don't want to be in a position where we're facing hundreds of millions of dollars in cuts. So thank you again to our clients and to our community partners who share their stories and allow us to share them with you here today. Next slide, please. So we just heard a lot from Gordon and Signe. They went through line by line what we finally know the cuts would look like, and they don't look good. So we're going to keep saying what we've been saying for the last few months, which is that the next few days are critical. Your action is critical. We need all of our congressional representatives to know that we want hands off Medicaid and SNAP. So we're going to run through our typical calls to action, which is, if you haven't done so already, please call Senators Blackburn and Haggerty and your member of Congress at the toll-free number on the screen. Let them know that you do not want Medicaid and SNAP cuts. Hands off Tennessee. We want these programs for our community members, and we want to maintain the access to services that we have now. Call them, write letters, whatever is you're able to do, please engage. When you do that, you can also go ahead and ask 5 more friends to call. Let them know that they should also take action on behalf of Tennessee to protect access to services. Today, May 14th, is the Medicaid Day of Action, so continue to voice your support. This is a time when our voices are critical. Our voices have already made a difference, and we believe they will continue to do so. So if you needed a day, a push to take action on Medicaid, do so today. Finally, on the SNAP side, the Agricultural Committee is still marking up the SNAP bill, so keep the pressure on. We don't want to hold off. We want them to know that we're still paying attention. So again, every single day is critical. Every voice is critical, so don't shy away from taking action. Next slide, please. We are still circulating our organization sign-on letter. We will share this out in the recap, but please scan the QR code on the screen or click the link in the chat to, if you can, on behalf of your organization, add your name to our Hands Off Medicaid and SNAP letter, which we will be sending shortly. We want to make clear that there are coalitions here in the state of Tennessee that are paying attention and that want to protect these critical programs. So please, please, please add your organization's name and join us in the fight. Next slide, please. So as we mentioned earlier, this is our Q&A portion. We'll close out with this. The Q&A feature is on your screen. If you can, click on the Q&A box and type in your question, and we'll go through them turn by turn. Gordon and Signe, if you can, please turn your cameras on. Some of these questions will be thrown to either or both of you, and we'll just kind of tag team our responses. First question is, do we have any idea who will be cut if these programs are passed, or if these cuts are passed? Are they looking to drop certain populations, change the income standard, or just no longer covering certain services? Gordon, I believe this is for you. This is on the Medicaid side. So what do you think? can we say we know who are cut now?
Yeah, I think we do. I mean, I think we know what these cuts look like. And I think it will look very much like what massive disenrollments have been in this state in the past, what it was last year and what it was 20 years ago when hundreds of thousands lost their coverage. Anytime you put people through more eligibility determinations and you make those more difficult, you're going to lose a lot of people. And sadly, the people least able to withstand the pressures and the repeated calls to a call center and the repeated documentation of their eligibility and the repeated nagging of their employer to provide pay stubs, et cetera. Whenever you put people through that, the people who are least able to do it are those whose disabilities or life circumstances make them particularly vulnerable and who need the coverage the most. So it's a pretty cruel process, but it's all dressed up as, well, we just want to make sure the right people are on the program. So we know that when you do it that way, you're really cutting across everybody. I mean, in our litigation, in the AMC lawsuit, our plaintiffs ranged from children with special health care needs, life-threatening conditions, to people in nursing homes, to women with breast and cervical cancer. There really was there's no rhyme or reason to who gets snared by the red tape traps. So that's the way they're going to do it.
Thank you, Gordon. I've got another question on the Medicaid work requirements legislation here in Tennessee. Does it have a trigger requirement? And if it does, and if it does not have a trigger requirement, is it almost for sure that the legislation will be filed next year? What exemptions do you suggest that we work on?
Sadly, it's done. It is sitting at CMS, the federal agency, and the threat of litigation prevented the Trump administration from approving it. But if this bill passes endorsing work requirements, I think it'll basically be ready to be approved. So that's why I think we're in a very unique and unfortunate situation with regard to work requirements that will be triggered by the passage of this bill if it's passed, even though the bill itself doesn't. The work requirements are more lenient and don't take effect for 4 years. They will have the effect of pushing our pending Tennessee waiver out the door.
Thank you for clearing that up, Gordon. Signe, you had a question for me from the chat. Just want to make sure everyone hears the answer. When you presented the amount that Tennessee would foot the bill in the hundreds of millions, was that the annual cost for Tennessee?
Yeah, that would be an annual cost. So every year right now, Tennessee pays 50% of administrative costs. So I'll put it in summary BT terms. Last year, the state paid about 5.5 million in summary BT costs, but the total cost was 11 million, and the feds paid for the other half. Moving forward, the states would pay 75% of administrative costs annually. So just based on past years, a 75% cost would be verging on $400 million. So 385 million, just based off of what we paid in 2023. And for SNAP costs, families get SNAP benefits every month. So every month, Tennessee would pay 25% of what that benefit amount is. And we would go from paying zero of the benefit amount to 25%. And that would be, again, on past trends, it could cost the state over 300 million, depending on who's eligible for SNAP. And so the question is, how is Tennessee gonna pay for that? And will they pay for that?
Thank you so much, Signe. I've got another question. I think this could apply to both Medicaid and SNAP. from an anonymous attendee. Is it your sense that the indirect strategies of increasing red tape and postponing implementation of cuts for years are palatable enough that the needed moderate Republicans across the House and Senate will pass them as part of a majority? This user thanks you for answering them.
Yeah, I think that's the strategy, and I think I think it may well succeed. And I mean, I'll just be frank with folks. This is not looking good in the House. I think we have dodged some pretty large threats to Medicaid. As bad as this is, there were some structural changes that could have really demolished the program. These cuts are going to cause enormous human suffering and a significant incidence of death. But the program will retain its basic structure. The SNAP changes are structural. I mean, if you require the state to put up the money, this state has shown its lack of willingness to put up even a few $1,000,000 to feed hungry children during the summer. So I think that if it passes the House, then it goes to the Senate. The Republicans can pass it without threat of a filibuster. They've probably got the votes to do it. And I think the message at this point is we've given everybody a lot of detail here today, so you know that these threats are real, that we've been promising detail. Now we haven't. We felt like we needed to share it. But I think the message is still very simple. Please call. I'm sure everybody has already contacted the delegation. Please reach out to as many of your friends as you can impose on and get them to call, and do that every day with more friends between now and next week. If this passes the House next Wednesday, the hill just keeps getting harder and harder for us to climb. It's easier to kill it in the House than it will be in the Senate. So, and I think the message is simple. You don't need to recite all the details we've given you today. Just the message is hands off Medicaid and SNAP, hands off the safety net. Honor President Trump's pledge to not touch Medicaid. Those are the messages. And just get as many people to call as possible, to the senators as well as to your House member. That's where we are. It's frankly getting pretty desperate.
Yeah.
Wait, real quick, Jane, I just wanted to piggyback on what Gordon said. Even if you've called, now that you have this information, now that we have more details, if there's something that resonates with you that you've talked to your congressperson about, call them back and say, now I know this. You didn't have the details before. Now I have these details. This isn't good. So even if you call again, and like like Jane and Gordon have said, tell your friends to call too. Because I think harassing them as much as possible is really what we need to do. And even though it's looking grim, there's been enough disruption that has helped to put the brakes on this and has helped to slow it down. So share your stories, call them again.
Yeah, that's a great point, Signe. And when we say harass, by the way, we mean polite. We mean
yes,
keep after them in a
with
persistent.
kindness.
We need to, yeah, but in a polite way. And we now have not only the details, but we have the nonpartisan Congressional Budget Office. So you get a staffer who says, oh, this won't cut anybody. You can just say, no, I know that the CBO says it's going to cut off millions. And because what you're conveying when you say that, you don't want to get into a big debate, but you just want them to know that there will be accountability, because ultimately people are not going to buy the glib statement that this is only fraud, waste, and abuse. This is not touching anybody that will lose their benefits. No, we now have not only the details, but we have the arbiter of this thing, the neutral evaluator, which is their own Congressional Budget Office. And you need to let them know that you know. So that's Signe's point about calling them back and in a polite way saying, I know that this is going to cost people coverage. That's worth doing. And I would certainly emphasize, given our delegation in the House, well, Senate as well, but I would really emphasize this is going to devastate rural Tennessee communities. Whether people are on these programs or not, they are so reliant on these safety net programs that it's going to impact everybody in those communities and their local economies. It's going to be harder to keep the grocery stores open. It's going to be harder to keep the hospitals open. It's going to be harder for people to get groceries and care regardless of their circumstances.
Thank you, Gordon Signey. Gordon, I'm going to convert one of these questions to a yes or no. We have someone wondering, is it of any benefit to contact members of the CBO?
No.
Thank you. I'm going to combine two questions for you, Signey. We have folks wondering essentially how bad could SNAP get in Tennessee if Tennessee doesn't take on the cost sharing burden, or if there's so many costs that the state is facing overall. Is it going to get to a point where the SNAP program is not going to exist anymore?
It's not great, right? I think it bodes towards fewer people participating, and that's the goal behind this, is how do we find ways to get fewer people to participate. So I think it's a major problem where some of the moderate Republicans will actually push back on this piece. For Tennessee, yeah, we've historically had problems with the state paying for the programs that help to feed people, and so I would see that I could see that it would limit the number of people that would be able to access the program. And also when you take into account that they're looking at trimming the administrative piece of it and cutting back on the people who actually operate the program. We need people to be working at DHS, and so trimming them, but then expecting the state to do more is going to make it really difficult for us to reach all the people that are struggling with food insecurity and that would actually be eligible for SNAP benefits.
If I can just add to that, if it is structured the way Medicaid is structured, then the way it works in Medicaid and the way it has worked in other programs is the state incurs the cost, then submits a bill at the end of the quarter to the federal government to be reimbursed for the federal matching share, which means the state has to come up with the money up front and has to be willing to incur that cost, or no money at all is spent. The feds don't put in until after the states have already ponied up. And that raises some profound questions about the future of SNAP in a state like Tennessee.
Thank you. And now we're down to 2 minutes. So I'm going to quickly answer some questions in the Q&A myself. We have someone asking, whatever is decided, when will it take effect? There are a couple of different timelines. What we saw, as Gordon said, what's written in the legislation is that some of the Medicaid changes will take effect in January of 2029. Is that right, Gordon?
Yes, but others will take effect. The ones that will have the most sting are pushed out beyond the midterm congressional elections next year. So that's
Okay.
when we'll begin to really see it, because they don't want people to go to the polls having seen what they've done.
Thank you. And Grace Smith asked, Trump has said Medicare is off the table for cuts. Has he said he won't touch Medicaid? Yes, Gordon did briefly cover. President Trump has promised not to touch Medicaid. So that is the fire that we are holding our congressional representatives to, because we know that there's a promise that Medicaid will be spared. That is not what we're seeing day to day in the hearings right now. So we want to make sure they know that we know Medicaid should be spared. Gordon, any one sentence to add to that?
Just honor President Trump's pledge. Let's put it over on Congress. Let's pocket what President Trump has promised, not blame him. Just tell Congress, whether we support Trump or we don't support Trump, we have his pledge. We expect you to honor it.
Thank you. And the very last question, Gordon, are there any populations that are carved out of work requirements, such as people on the DID waivers?
People on the DID waivers would be carved out of the work requirements. But again, all of this depends upon the ability It's like the red tape that I know we keep coming back to it, but it's very real. An exemption doesn't mean anything. A guarantee of coverage means nothing if the agency that's administering the program doesn't have the staff or the right computer system or the political will to actually implement those protections. And that's where people lose their coverage, because historically that has been a huge problem in Tennessee.
Thank you, Gordon. So we'll share quickly some links to the live stream of the debates in the chat, just so you all know this is an active conversation. We are sharing information as we're receiving it, and you can catch up too. You don't have to be a policy wonk to follow along. I think it's really powerful to know what your representatives are saying in these debates. So we will share these links in the chat, and you can or you can scan the QR code and follow the conversation yourself. Next slide, please. So that was the Agricultural Committee, and then we have the Energy and Commerce for Medicaid. Next slide, please. So thank you everyone for joining us today. As always, we are eager to bring you real-time updates on these federal cuts. We want you to know that you have a voice, you have a role to play in protecting Tennessee from the worst of these cuts, and we'll keep the work going. So thank you for joining us for another Wednesday briefing. We're always available for your questions, and we look forward to hearing from you all and catching you up next week. Thank you all for your time this afternoon.